Hi, welcome to the webinar today. This is Welcome to California Open. This is Amber Christ, a directing attorney with Justice and Aging, and I am joined today by Rebecca Alcantar with the Latino Coalition for Healthy California, Eileen Espejo with Children Now, and Mihei Jung with the California Pan-Ethnic Health Network. So we will be your speakers today, and we want to welcome you to California Open. Next slide, please. So just a few housekeeping items. All participants will be muted, but if you have questions, please type those into the chat or question box, and we will try to get to those questions at the end of the webinar. The recording of this webinar will be made available on the website post-webinar, and you will also receive an email with the webinar recording as well as some additional resources that we will reference during the webinar. If you have any technical issues during the webinar, please email Aviva at aprager@cpen.org. All right, so next slide. So the big news is that the California Oral Health Network has been rebranded, and we are now the California Oral Health Progress and Equity Network, or for short, California Open or Cal Open. And just for some historical context, so we are linked to the federal Open Network, which was previously known as Oral Health 2020. And they rebranded to the Open Network last fall. And we thought, since we are so connected to that federal network, that we too would embrace that change and change the California Oral Health Network to Cal Open, since it better reflects both our mission and values as a network. And we want to, just for some historical context about how the California Network got started, for a few decades now, there's been a lot of great oral health advocacy going on in the state of California, and that was led predominantly by the California Primary Care Association and the Center for Oral Health, who brought together a really strong coalition of organizations and stakeholders to advance oral health in California. And then in 2015, there was a lot of engagement going on with what was then Oral Health 2020 to do this federal kind of movement towards improving oral health. And we got connected up with that group. And in 2015, there was sort of an opportunity for funding to both grow and strengthen the network here in California. And so the California Pan-Ethnic Network was granted a 3-year contract to lead the network as a backbone organization, and we created the then California Oral Health Network. So we are now rebranding to the California Oral Health Progress and Equity Network, and we're going to today give you some updates about what the network has been up to, and then opportunities to engage at many different levels and learn about the policy platform that the network has developed. But first, I want to introduce you to the new website for Cal Open. So next slide. We have this brand new website, and it is available at www.ca-open.org. So I encourage you to log on to that as soon as you can. A lot of work went into making this a valuable website in terms of acting as sort of a one-stop shop for all of the resources regarding oral health advocacy here in the state of California. So you'll find on that website a lot of different things. So there's an About Us tab that includes some resources and information that Rebecca's going to cover in just a second about our mission and our values and who we are and how we're structured. It's going to include information about the network's policy priorities, which Eileen is going to cover when she jumps on. And then there's also additional information about how you can engage in the network, which is what Mihei is going to talk about. Additionally, on the website, it really is a repository for all of the resources that are kind of available here in California around oral health. So if you look at the next slide, we have it's a screenshot of the resources page. And so that resources page is really about including information around the toolkits and webinars that have been put on in the state, from, advocacy organizations, oral health groups, the state, counties, all of the different places and organizations that are putting on education and trainings, information regarding data and research around oral health. Newsletters are available there. So the California Open puts out quick bites, which you might already be receiving in your emails. And if you're not, you should sign up because that's a wealth of information that goes out regularly to the network. So that's available there. In addition, there's some outreach materials. Also on the website is an event page so that you can stay up to date on all of the different happenings that are going on across the state. So you can see here the events taking place on July 31st, which is today. We have our webinar. And then tomorrow in the County of Los Angeles is having its Oral Health Summit to review its county oral health plan here in Los Angeles County. So lots of information is available on the website, and like I said, you should visit it as soon as possible because it will provide you with a lot of information about the goings on in oral health across the state. And now I'm going to turn it over to Rebecca to talk about the network's vision and mission and how we're structured.
Thank you, Amber. Hi, everyone, and welcome to California Open. I'm Rebecca. I'm with Latino Coalition for Healthy California. And first of all, so who is the California Oral Health Progress and Equity Network? We're Californians who believe that achieving optimal oral health is necessary to improve one's overall health and well-being. And we also believe that oral health is a social justice issue. We have definitely seen a movement at the national level, but also at the local, regional level and state levels in really moving forward this oral health equity framework in order for all communities to be healthy. And so what we do, we're a network of engaged, diverse stakeholders from multiple sectors. We're committed, again, to advancing oral health equity. And we do understand that it's going to take everyone and that everyone has a role. We are going to need everyone's expertise, community organizers, advocates, providers, in order to really have this collective impact to improve overall health for Californians and really looking at how we address the root causes of poor oral health, particularly for those who are historically underserved. And why do we do this? Again, poor oral health does impact our overall health. We know that it has dire consequences that impact our education, job opportunities, security, and also is the root cause and contributor to other chronic conditions, including heart disease and cancers. So one of the exciting parts of being part of California Open is in how we approach our work. We use a social justice lens. Latino Coalition for a Healthy California with various other partners that are part of the community-based organizations and grassroots and advocacy organizations are excited to be part of Open, including the national level Open that is looking at how we advance the systemic social change that is impacting oral health. And the way in which we've been doing this is by strengthening our relationships, creating deeper connections among folks at the national level, but also at the state level and local level to look at how we can improve our approach and strategies in order to get to a healthier California. We provide timely information and share best practices through different platforms. We also have conversations around how we align state and local efforts, as well as provide opportunities for engagement and advocacy, and always looking at how we advance equitable oral health policies as well, by keeping close communication to the community needs and what we're hearing on the ground. So we can move forward to the next slide. Our values for the Oral Health Network. Our values include equity. We work to address the overall health of all of our communities. We understand that we're interconnected and that we will be able to be successful if we do address the needs of the most underserved and impacted communities to really get at the root causes of the oral health disparities. We value inclusion. We respect everyone's diverse values, viewpoints, and cultural and linguistic backgrounds, and we seek to create spaces for voices to be heard who have not been usually reached or that have typically not been engaged in the decision-making processes and policy-making processes. And also, accountability is really important. We seek to intentionally create and support processes, relationships, and activities that can hold policymakers and healthcare systems accountable to provide that quality care and service that all communities deserve. And leadership. We engage with communities to develop strong community-based voices and leaders to ensure solutions that reflect what the communities need and want, and that also leverage that expertise that comes from the community and consumers and patients. Also, we come from a framework of collective impact, understanding that in order to have success and be impactful, we will have to work together and collaborate and continue to build stronger relationships and bonds to have that larger systemic impact in order to improve oral health outcomes for everyone. We can move to the next slide. So how are we structured? We have a statewide connection team. The team is tasked with working very closely with CPEN, who's the backbone organization to support the needs of the network. So the statewide connection team is composed of the connectors and weavers that are also part of the community that we are prioritizing that represent those community voices. They're experts and leaders in oral health and also overall health. They also have done work in social justice, and the organizations do have a lens of health equity in terms of how they approach the work. There are also organizations that are committed to championing oral health through a lens of health, social, economic, and racial justice, and are connected to other national, state, and local networks that can bring in that diversity of perspectives. They also align state and local oral health efforts and are also connected with national partners and funders. In addition to the statewide connection team, we have the response teams. And so the purpose of the response teams are to establish and delve deeper into specific projects to create recommendations. So for example, we have the governance response team, whose responsibility is to really identify the framework for the network governance and decision-making process that they would then share with the statewide connection team. In addition to the governance response teams, we have the communication and engagement team with the responsibility to identify strategies to engage new and existing individuals, organizations to join the network, and continue to have a community that's energized to move forward oral health equity strategies and action plans. In addition to that, this team would also develop and disseminate messages and inform activities throughout the network, and would also create onboarding processes for the new members and identify potential network activities and allies that can support the work. We also have the policy response team who is tasked with creating a space to engage in dialogue about potential policy opportunities and provide updates of the policy landscape. This team will also provide assess current strategies and support members with analyses, recommendations, and opportunities to take policy and advocacy action at a future time. And then finally, we have the backbone facilitator, CPEN, that would engage very closely in very close communication with the statewide connection team. And we can move forward to the next slide. And so here we have a list of the statewide connection team members at this point. So as you can see, it's a diverse group of stakeholders, advocates, and providers that are very invested in moving forward an oral health plan and strategy that really advances health equity and really looks at addressing disparities among key populations in the state of California. We can move forward to the next slide. And now I would like to turn it over to our colleague, Eileen Espejo with Children Now, that will be giving an overview of the policy platform for the California Open Network. And again, thank you so much for joining us today, and we look forward to continuing our conversation on engaging with the California Open Network.
Thanks, Rebecca. So good morning, everyone. This is Eileen Espejo from Children Now. The slide you see before you is a compilation of what we came up with as the policy platform. And by we, I mean that over the past year plus, there have been several organizations that came together periodically to share their policy priorities and look for ways to leverage and coordinate efforts. We also looked at, some of you might have been involved with the grassroots lead organizations in California, so the findings and assessments from those groups. The California Oral Health Network, at the time, which is now California Open, had also disseminated a survey to members who had, or attendees, I should say, who had gone to the regional convenings that CPEN had convened. That was a survey that was administered a few months ago. So all of these we collected to identify current as well as recent policy priorities. And so this is what has informed this policy platform screen that you see right now, this slide. And these are the long-term changes that we are envisioning for oral health. And hopefully these still resonate with you all. And if we can move on to the next slide. So from that policy platform, we identified what the key policy priorities were to address that policy platform slide that you saw earlier. So health for all, language access, virtual dental homes, sugar-sweetened beverages, and as well as monitoring the Proposition 56 tobacco tax revenues that were coming in. So I'm going to just go through with the rest of my time to tell you kind of the update if you don't already know what's been going on with each of these things. And I know that there are people probably on the call that can also speak more to current status of these, but this is the information that I have. So with Health for All, we all know that Governor Newsom did sign the budget bill, which expands Medi-Cal coverage to all income-eligible undocumented young adults ages 19 through 25. And the work to be done with that is going to be to make sure that those eligible undocumented young adults are aware of this newly expanded Medi-Cal coverage for them, as well as to ensure that they understand that dental benefits are part of that Medi-Cal coverage. With language access, some of you probably saw in the recent email that went out to the California Open Network that advocates on June 10th had submitted a joint comment letter to the Department of Healthcare Services, the Medi-Cal Dental Division, regarding concerns around language access issues for English proficient members seeking Medi-Cal dental services. There was also on April 30th earlier this year, some of our member organizations had hosted a webinar that focused on providing an overview of the Medi-Cal dental program, including coverage basics, language access rights, and the resources and opportunities for advocates to engage and improve access to dental care and language access. Those are all in the quick bites from, I think that was from the June one. And there's a PowerPoint presentation, there's a webinar recording. So again, speaking to the resources that California Open has for all of you to download and access. With virtual dental homes, there had been efforts that the Children's Partnership, West Health, I know, and Dr. Glassman and California Primary Care Association had been seeking some clarifying language regarding virtual dental home through trailer bill language. Unfortunately, that proposal did not go through, and so I think there are going to be efforts, I believe, to work with community health centers and clinics to figure out how we can make sure that establishing a patient relationship through store and forward teledentistry by FQHCs and regional health centers is okay. That clarifying that a face-to-face visit is not required in order to establish that patient relationship. That was the issue that was being faced with the virtual dental home model. With sugar-sweetened beverages, you might have all seen that unfortunately the 5 bills that had been presented did not move anywhere. The last one to have not moved was SB 347, which was the labeling of sugar-sweetened beverages. Unfortunately, none of the bills that were presented were able to get passed where they needed to get passed, and so they've been shelved for the year. However, there is still the potential for possibly a ballot initiative for 2020, which we will continue to monitor. And then on the Proposition 56 monitoring, as you all know, Proposition 56 provided supplemental payments to both medical and dental providers, as well as a loan repayment program. This was a battle that we used to have to do year to year to ensure that the supplemental payments either went on from one year to the next year, including all the different kinds of services that for the purposes of this call that dental providers could bill for. And what we found out for this budget is that the supplemental payments are going to go through 2021, which is good, so we don't have to do this year to year. There was a recent Denti-Cal bulletin. I'm not sure if that's gone out yet to this group, but there is a Denti-Cal bulletin that did go out describing all the different services that are now going to be receiving supplemental payments effective now through 2021. So I think with that, I am now going to hand it off to Mihei to talk about how you can engage in all of these efforts and others.
Thank you. Hi, everyone. My name is Mihei Jung. I'm the Community Advocacy Director at California Penn Ethnic Health Network, CPEN. CPEN is the backbone facilitator for the California Open Network. And what that means as a backbone facilitator is that we provide a lot of the administrative and coordination support and the operation support necessary to bring this network closer to everyone that wants to be involved. So at this point, you've heard from Amber and Rebecca and Eileen about the different structure of the network and the mission and the vision and the policy priorities that we are we're prioritizing. And so there, are different ways that you can engage with the network. Again, anyone, who's interested in oral health and, working on oral health equity, you should consider joining the network. So there are several different ways that you can interact. So one is sort of like a light touch. You can check out the website and take a look at the resources that's available there. You can also sign up by emailing the CA Open Oral Health at gmail.com. And, we'll add you to the listserv so that you can receive a lot of information, latest policy updates, and other oral health events that are happening in California. You also will receive what's called Quick Bites, and that is a monthly e-newsletter. And on the slide, you can see on the right side what the newsletter looks like. And it's divided into 3 sections. There's policy updates, there's advocacy updates, and there's also events. So this is, a really nifty tool that you can keep learning about. So, you can get the latest information about what's going on with the topic of oral health. When you sign up, you will be receiving an email from us with a survey link. And this link will ask for additional information from you in regards to what kind of work that you do, what sort of advocacy efforts you're involved in. It will also ask you for your interest for California Open. So earlier, we talked about the different response teams that are available right now. And so there are 3 different response teams that are in charge of operating the network. And so, we would ask you which response teams that you'd want to be part of. And, right now the information we have available is that we are interested in gathering data from a lot of you to see, which response teams you're interested in joining. And then, we'll reach back out to you when we have more structure in place on how you can meaningfully engage in the different response teams. We also have the website regularly updated with events, so you can check there regularly. And the policy page will also have the latest updates so you can track issues and the policy priorities that you are concerned about. So this year in 2019, we also plan to hold at least 2 webinars before the end of the year. One on policies we have prioritized this year, and another one on social determinants of health and oral health. So then again, when you sign up, you'll receive the survey link, and you can see the survey link on the slide. And this participation survey is very, very important for us to understand your interest and your preferred level of engagement. Always feel free to send information and requests to the California Open Gmail account, and we will forward to members who seem relevant or to response teams that can respond. So there you can see the email, caopenoralhealth@gmail.com. And so you can email, anything, events, if you want to get connected with somebody, you want to be added to receive Quick Bites, or if you have, if you want to share potential topics for webinars, you can, send all of that to the email, and we are going to be monitoring, and we can, connect you with people that can answer your questions. So there's a role for everyone in a network, from sharing information and coordinating an event, and the network is open to everyone who's interested. So we're really looking forward to receiving your ideas resources and engagement, and we can't wait to interact with you all. Okay, next slide. Okay, so again, as our speaker shared earlier, that Open Network is a national network of organizations, individuals, coalitions, and others. And so know that you are interacting with a California network, but the California Open Network is part of a national movement. So that is another opportunity for folks to get information that if you are interacting with a California network and there's any questions or opportunities that we cannot answer, we can always tap into the national network and get, and provide you information or education that you might be needing for you to, push your work forward. For example, what are some oral health policies that are succeeding in other states, and how can we learn from that, right? So, this is really helpful that we are connected to the national network, and I think that this makes all of us more powerful. Great. Next slide. So that pretty much completes our presentation and the information that we have prepared for you all as the website launches and our network launches. So now we will take questions.
Sahili, this is Amber. We can't see the questions if they've been asked. I can only see the chat box. So.
We haven't received any yet. And no, I'm messaging you. Not yet.
Okay. We encourage participants to ask questions if you have them, so that we can, particularly around engagement or joining the network if you haven't already joined, or anything else.
I think while we give folks, it looks like we got a question. 1 second. One moment, please. Okay, so the question here that I received was, do you need to re-sign up for California Open on the website, or will our prior Oral Health Network registration transfer over? So I can take that. This is Mihei. You don't have to worry about re-signing up for the California Open Network. If you are already registered and signed up with the Oral Health Network, we will make sure to transfer all the contact information to the new Open Network. It's essentially a name change. The backend infrastructure and database is really the same. But if there's going to be any discrepancy, we'll make sure everything gets transferred over. Great. So there's another question. Will your website house literature regarding race equity for dental professionals? Anyone wants to take that? So the question is, will your website house literature regarding race equity for dental professionals?
This is Amber. I think the goal with the resource section is to put as many resources as possible up. So to the extent that those resources exist, yes. And we're really relying on the network as a whole to provide those resources that can be posted. So as Mihai was talking about, this is really network driven and the engagement of the network. So with regard to webinar opportunities, for example, if you have a webinar idea or if your organization is putting on a webinar, then you would want to let the whole network, you would want to let the network know so that we could include that on the website. The same with resources. So this is sort of a resource bank. So to the extent that all of us that are in the that are doing the connection team have resources that we're providing, will be providing, but the network too should be providing those resources and making sure that they get posted on the website. Does anyone else have anything to add?
Yeah, I'll add.
Yeah.
Oh, go ahead, Rebecca. Go ahead.
Yeah, I would say that a lot of there are a couple of partners that are referred to as the GLOWs, the grassroots lead organizations that are working on also gathering the tools that we have that we can upload to the website. That would include tools related to cultural competency and quality care for the diverse California communities. And so, yeah, again, like Amber mentioned, we'll be gathering some of the resources.
Great. There is another question here. Is there a liaison for the oral health infrastructure grant? Is there a liaison for the oral health infrastructure grant?
This is Amber. I don't know what that's referencing. Are we?
Yeah, I'm not familiar with the oral health infrastructure grant. Perhaps the person that asked this question can send an email describing, maybe asking, maybe providing some context around the oral health infrastructure grant. And we can probably get you connected with someone who would be involved in this effort. Anyone else want to add to that?
Yeah, this is Eileen. It might be referencing the HRSA grant that was given out to FQHCs, but I'm not sure. But I think there is one from this year that was around oral health infrastructure for FQHCs primarily. And I know there was another one too, though, with maternal child health, working on integration with primary care providers. But as Mihai said, a lot of us who are on the state oral health connection team are also involved with Dr. Kumar's state oral health plan on his advisory partnership. So if we don't have the answers, then I'm sure somebody within that partnership committee does.
Great. Thank you, Eileen. Thank you, Amber. And one flag for all the attendees that are listening right now. In 2018, in February and March, when California Open was called Oral Health Network, we conducted regional convenings in Los Angeles, San Diego, Oakland, Fresno, and Sacramento. And if you go to the CPEN website, And we might actually port these convening reports to the new California Open Network, but based upon the regional convenings, you know, one of the biggest needs that were identified was really better organized and centralized information and connections. And so we're hoping that, you know, utilizing our website and through the e-blast and the webinars, you know, we would be able to provide timely and meaningful information to you all. And I know that a lot of folks that are involved in the oral health space, you know, some are involved with providers, some are involved with the counties, some are, you know, doing direct service, some are involved in schools. And so, you know, we really encourage you to send along any, you know, information or updates from, you know, your regional communities and even emerging issues that are arising in your communities for folks that are really impacted by the lack of access to oral health care, then we would want to hear that as well. So it's not just simply information sharing, but we want this network to be, you know, an area where we understand the emerging issues so that we can respond accordingly. And so that's kind of the last thing that I wanted to share. It looks like we don't have any more questions. So I don't know, Amber, Eileen, or Rebecca, you want to share anything else?
This is Amber. I will just encourage everyone, and thank you so much for participating today. If you're already part of what was formerly the California Oral Health Network, which has been renamed Open California, we really want this network to grow. So share this information with your partners, and not just your, you know, everyday partners, but partners that you might think are non-traditional partners and maybe not in oral health, but should be thinking about oral health, because we're trying to ensure that people are thinking about oral health as part of overall health. And so just really want to thank everyone for participating, and share, share, share.
Great. Yeah, so I think we're going to end the webinar a little early. You can have 20 minutes of your day back.
Thanks all.
Thank you, everyone.
Thank you.